I'm Dr. VP Bhalla. I'm Director of the Institute of Digestive and Liver Diseases at BLK Superspeciality Hospital, and I head the Surgical Gastroenterology unit. Surgical Gastroenterology is a field which deals with the diseases of the organs which make up our digestive system: the liver, the stomach, the small intestines, the large intestine, the spleen and the pancreas. My special interest areas are diseases of these organs, particularly of the pancreas. Now, the pancreas is a very enigmatic gland which lies deep inside our abdomen, surrounded by very many vital structures. The pancreas is a gland which is responsible for digestive functions in the body, especially digestion of proteins and fats. It's also responsible for producing insulin, which everybody knows is important for the control of blood sugars, and the absence of insulin often leads to diabetes. The pancreas is affected by many diseases, and these diseases may be, as is shown, traumatic, when the pancreas can be injured in accidents and in injuries. The diseases can be inflammation of the pancreas, and these can be acute. These are usually due to gallstones and alcohol intake. You can have chronic inflammation, which is known as chronic pancreatitis, which is especially peculiar to India when you have large ductal stones in the pancreas, and it eats away at the pancreas, causing the patient immense pain and is quite a challenge to treat. And finally, there are tumors of the pancreas which can both be benign, like in cysts, and they can be malignant, like in cancers. Today I want to talk to you about pancreatic cancer. Pancreatic cancer is a cancer which is becoming more and more common in the world, and it usually presents with, in an otherwise very healthy individual, suddenly it presents with jaundice, weight loss, or the recent development of diabetes. The pancreas has three parts, as is shown: the head, the body, and the tail. Tumors can occur in the head and body and tail, and all these tumors require specifically directed surgical procedures. Perhaps the most common and complicated surgical procedure done in the abdomen is an operation known as the Whipple's pancreatico-duodenectomy, which involves removing the head of the pancreas and all the organs which surround it, and then recreating the anatomy to make sure that the food passage, the passage for the bile juice and the passage for the pancreatic juice finally find their way back into the intestine, where they can help the digestion of the food. These operations can be delivered safely by teams which are routinely dealing with the management and surgery of pancreatic disorders. Often, these long operations and tedious, complex, challenging procedures are associated with complications. And when they do happen, you want to be in a center which is well equipped to treat these complications and deliver you safely. The GI surgery team of the BLK Superspeciality Hospital has now been in existence for the last 10 years. And in this last decade, we have been referred cases from all over the world and India for the treatment of complex pancreatic diseases. The BLK Hospital has, on one platform, provided all the consultants, all the specialities, and all the necessary modern technologies which go a long way to make pancreatic surgery safe and outcomes predictably good.
Dr. VP Bhalla, along with his GI team at BLK Superspeciality Hospital, hold the vision of setting up a benchmark in GI surgeries in both India and abroad.